Excuse me, ladies and gentlemen. Thank you for your patience in holding. We now have your presenters in conference. Please be aware each of your lines is in a listen-only mode. You may submit your questions electronically anytime by using the Q&A pod located to the left of your webinar platform. You may also download a copy of today's presentation using the Resources pod located directly below the Q&A pod. It is now my pleasure to introduce today's first presenter, AHA moderator, Monique Showalter. Ma'am, you may begin.
Thank you so much. Welcome, everyone. This is Monique Showalter with the American Hospital Association. All of us here at AHA hope each of you are safe and well, and thank each of your organizations for your outstanding care and dedication to the patients of your communities. AHA is pleased to be hosting today's webinar entitled Forging Stronger Links in Your Healthcare Supply Chain. Better supply chain management drives improved results. This webinar is brought to you through the generous support of the Quisitive organization. Supply chain operations represent a huge opportunity to reduce costs while maintaining efficient patient care and improved outcomes. Supply chain costs can account for 37.5% of total patient care expenses, just behind labor. So there's definitely a strong movement to include the supply chain in efforts to reduce costs. Improving supply chain management in key areas such as procurement automated replenishment management, e-procurement, and materials management helps to improve clinician and supplier relationships, maximize inventory investment, mitigate impacts of future pandemics and other disruptions, reduce administrative time on tasks, and certainly enhance patient care experiences. During today's session, we'll hear about key performance indication measurements to identify areas of improvement, solutions which leverage power apps and mobile devices that can be deployed quickly and show immediate returns, and also ways to automate workflows to streamline processes. Note, too, that we've allowed time for your questions. We've already received several questions, which our speakers will address as time allows. Note, too, that if you wish to download the presentation, you can easily do so through the resource section of your screen at any time during today's presentation. Quisitive has also provided some valuable additional resources for download, so be sure to take advantage of that information as well. Also, the event is being recorded, and the replay link will be sent to all registrants and attendees shortly after today's event. So let's move on to today's outstanding presentation. I'll introduce today's speaker. Our first presenter is Pat Becker, Chief Strategy Officer for Healthcare with Quisitive. Pat has served as Executive IT Professional in Healthcare for 25 years. As a HIMSS Fellow, she was CIO and VP of Information Systems at the University of Chicago Hospitals and Health Systems, and served for a decade as VP of Technology Services, CIO, and Chief Privacy Officer at the University Health System Consortium. Currently, Pat serves as Quisitive's Chief Strategy Officer for Healthcare, bringing a wealth of industry knowledge to Quisitive's development efforts. Our second presenter is Suresh Krishnan, Chief Technology Officer, also in Healthcare, with Quisitive. Suresh is a healthcare IT leader with CHCIO certification and more than 25 years experience in application development, infrastructure management, and cybersecurity. Suresh is currently serving as Chief Technology Officer with Quisitive, having previously been Vice President of IT and CTO at Amita Health, where he provided IT leadership to teams supporting 19 hospitals and 250 outpatient facilities. Suresh has also served as CTO and CISO at Northwest Community Healthcare and has a BE with honors from the University of Madras in India, a certificate in lean Six Sigma and from the University of Illinois, and is among the top 100 CIOs in hospitals and health systems in 2016. It's now my pleasure to turn the floor over to Pat to begin today's presentation. Pat, the podium is yours.
Hello. Thank you. Thank you very much. So today this is the agenda that we're going to go through. We're going to start off with a brief discussion of who Quisitive is, since many of you may not know who we are. And then we're going to talk about supply chain management, its challenges and opportunities. We'll quickly go over a case study, and then we'll wrap up with next steps. And then we'll turn it over to you for any questions that you might have. Next slide, please. Go ahead, Sue. So the first item I want to discuss is who exactly is Quisitive. Some of you might be aware of us and some of you might not. We are a global organization with over 700 employees in 17 hubs, serving over 7,500 global customers. Our strength is in our internal specific industry expertise matched with deep technical expertise. We provide solutions to hospitals and trusts, care coordination, medical devices, and home health care organizations. Some of our customer success includes El Rio Health, which is in the Southwest, which moved from an on-prem to a cloud with Dynamics 365 and MazikCare. We've seen great results in their giving back time to clinicians and less time on administrative staff. Synesis, who is the largest home health care company in the UK, recently deployed Dynamics 365 and MazikCare and now has visibility of prescriptions for chronic care patients from when the provider writes the script until the patient receives the dose. Informed Diagnostics last year modernized their applications to better support their end user patients and improve resiliency from external factors, all of which we've been suffering from over the last couple of years. All the organizations on this slide had one goal in mind: to better serve the patients. As Microsoft's Healthcare Partner of the Year, we are proud to be on this journey with them. Next slide, Sue. This is a brief overview of the services we provide and the different touch points we have with our healthcare solutions. They impact data, patient care, supply chain, revenue cycle management, and provide a roadmap to move from on-prem to the cloud. We work in all three of the Microsoft clouds: Azure, Microsoft 365, and Dynamics 365. Next slide, Sue. So now we're going to take a survey trying to ascertain your current pain points in the supply chain. So if you would take a few minutes to fill out the survey that should be popping up any second now. Here we go. So please pick out those items which provide you the most pain points for your organization. And we'll spend a few minutes and see where we're at here. Okay, it looks like the numbers are pretty much stabilizing, and there are two areas that are definitely taking the lead here, and that is different systems that don't communicate across department and systems, and the supply chain is much too time-consuming. Actually, time-consuming is now taking the lead here. And this is pretty much what we've seen as well. And some of the solutions that we've created with our amazing care supply chain actually lends itself to eliminating that time-consuming and the fact that there are different systems across the organization. And of course, contingency planning has become important for all of us over the last couple of years. So we're going to address some of these as we go through the presentation. So let's continue. Okay, so we all know how important supply chain is and the impact of supply chain on healthcare. This study was performed in 2019, but I haven't seen any updated results on it, but I'm sure if anything it's just become worse because of the pandemic over the last 2 years. Supply chain currently takes about 37 to 38% of the total cost of patient care. It's estimated that almost 18%, or about $11 million, could be saved. This is per organization. If we did some streamlining and standardization of supply chain processes. And yet in 2019, we saw that supply chain costs actually went up by 22%. And we know that over the last 2 years, because of supply shortages in the pandemic, that number surely has continued to grow. If we're able to optimize supply chain, many things can be improved. We can deliver an improved patient care experience. We can reduce administrative time on manual tasks. We can improve the clinical and supplier relationships. We can strengthen the supply chain bonds between the hospitals or providers in general and suppliers. And we can maximize our inventory investment. And with good analytics, we can also mitigate the impact of future pandemics. Next slide, please. So what's needed to move in that direction? The main thing is good data. We need to know how much we have and what we are spending. We need to develop contingency plans. Many were cut short during the pandemic. What have we learned from the pandemic, and how can we now change our contingency plans so we can be more responsive? Artificial intelligence, and Suresh is going to go through this in a bit more detail later, can assist in your analytics, but in order for it to be good, you need the correct data. There'll be greater need for bidirectional transparency and greater sharing of utilization among healthcare providers, manufacturers, and distributors. Next slide, please. It is critical that now that the pandemic is mostly over, that we forge new relationships with both onshore and nearshore suppliers, or invest in dependable companies that can fill our needs during peak surges. Just-in-time and lean inventory strategies need to be evaluated across the supply chain continuum to provide better documentation, monitoring, and predict product needs in the daily operations, as well as product demands during surges. We need to win back consumer confidence that we are ready for future pandemics and be able to predict those. One interesting event that occurred early last year was Intermountain Healthcare out of Utah actually published in the newspaper that they were short on orthopedic devices such as canes, walker, crutches, and they asked people go into their closets and into their attics and help them with this by bringing those devices into their organization. It was very effective. Next slide, please. Use of variance reporting and analytics can help identify savings opportunity. A laser focus on surgical supply usage, which surgical supplies often of that 37% of supply costs, they're between 40 and 60%. So about half the supply costs are related to surgical supply usage. So a hospital really needs to understand how they're spending that money. And it's critical to reducing waste within the OR. Helping physicians identify opportunities with lower cost items while maintaining patient quality outcomes can result in huge cost savings. Still, reducing physicians' allegiance to certain vendors and suppliers is not easy, and you need to have the right leadership within your organization to help overcome some of those barriers. Some things to think about is incorporating incident demand and peak demand in forecasting with forecasting tools. Use platforms that provide an enterprise-wide view and seamlessly integrate your supply chain platforms with other systems such as your electronic health record so that you know what is being used and when it's being used. Next slide, please. We all know that supply chain is a key part of patient care. We saw that it amounts to 38% of the cost of care. So it is important that while we want to reduce cost, we are cognizant of the implications on quality and safety of the care that's provided. So we have to do this yet cautiously, but it can be done. It's important that the process to evaluate what supplies are used and the need to move maybe to lower cost, that we do this in a collaborative environment, bringing in all the stakeholders. So that's administrations, that's clinicians, and that's the supply chain staff. I'm now going to turn it over to Suresh. Suresh?
Thank you, Pat. Can you hear me okay now?
Yes.
Yes. Good morning, good afternoon, everyone, and thanks for joining us. I want to talk a little bit about supply chain challenges. And some of these challenges I'm talking about are generic to supply chain, some are specific to healthcare supply chain. So I have implemented systems for over the last 30 years across multiple health systems related to healthcare supply chain management. What I have run into all the time is the standard ERP practices related to supply chain. Those practices do not fit healthcare very well. For example, if you take power management, whether it's a power management related to central supplies or the supply cart on the nursing floor or surgical preference carts and surgical supply cart in OR, the way of managing power is very different. I think getting real-time insights into the inventory needs, whether it is tied to patient acuity or other needs, getting real-time feedback is important. So your supply chain system need to be able to manage power based on aspects beyond just the standard cost and power levels, related to patient satisfaction, caregiver productivity, and many other things. The second thing is online portals. As you know, more and more suppliers are providing online portals, but every online portal being independent and different is not going to make your case easy to manage. So one of the ways the systems need to do is ability to order everything through a single plane of glass, and occasionally when you had to pop into another site and come back without impacting your workflow. That's critical for a supply chain solution. Another is supply chain supplier collaboration, managing the supplier relationships between multiple suppliers, providing our materials across the care continuum. You need to make sure there is visibility about delivery dates and late payments, other factors which could impact your supply chain. You need to have better visibility. And then next one is the order management process itself. The process, as you know, in healthcare, between capital improvement projects and IT procurement and routine medical supplies, the ordering process is so disconnected in most health systems. Having a system which can streamline all of that into a standardized process, which can still provide specific experience needed for these departments is critical. So having paper-based ordering for one process and then having online order for another causes a lot more, it adds a lot more cost and accuracy and other issues as well. And data, real-time data. I think one of the areas the newer systems do provide is improved processes is where data is collected real time. So it is usable right away. You don't have to wait for the month end to figure out your supply chain process whether it's working well or not. And integration. And someone talked about earlier in the survey, we talked about lack of integration between systems, between supply chain systems, EMRs, other back-end financial systems. There is lack of integration, whether it's EDI capabilities or others. So modern systems provide that level of integration, which makes it easier to tie in your patient care and associated customer satisfaction. And the amount of stress it puts on employees, strain on providers and staff. For example, some of the clinicians who want to order supplies for their area service line and having to go through a ERP-based system to go through multiple screens to order things, it takes a lot of time. So there are newer systems that provide Amazon-style experience where they can look at a picture and say, I want 3 of these and put it into a cart. Things show up. The clinical staff do not need to know whether it is coming from central supplies, it's getting transferred from another clinic, or it's getting ordered from outside. So, and a lot of this came into picture with the pandemic, whether a lot of health systems had gone to a just-in-time inventory model. When a pandemic hit, that had a negative impact on the patient care, even though it made sense a few years ago. So having a system which is flexible enough to go from just-in-time versus having an inventory which can deal with the pandemic, that is very critical. So next slide, please. So in terms of approach, how do you get there? I think even though I talked about having systems which can do everything within the same framework, the most supply chain systems are still very modular in the sense whether you want to implement package tracking or you want to implement capital-based ordering or you want to implement IT-based ordering, you want to do punch-out type of integration. Each of this could be phased in. So you find a framework, find a common platform, and then start working through each use case and still keep the data intact in one place. So, and the second part is patient-centered, making sure everything we do is with the focus on making patient care better, patient satisfaction. So that the framework has to support that. And in terms of a framework, healthcare, the most of the supply chain system I have implemented, technologically very challenging framework it used. The newer ones allow you to implement a framework which allows you to get to the data real time. You don't have to call up to the floor to find out if something is needed or so you need to have real-time data. And then it also helps you with your volume negotiation, your GPO contracts. A lot of that can be based on real-time data. You don't have to wait until the month ends. And the API, the newer systems give you application interfacing capabilities where you can directly connect with the external systems. So you do not have to write custom programming. Now, most of these are published integration points. And like I mentioned the spaced approach, where the spaced approach could be used to transform a single service at a time. Like I mentioned, one of the health systems, we implemented a package tracking solution where they can deliver FedEx packages to the right customer at the right time within the health system. And we also could do all the way to the other end where across 250 clinics, a clinician, a medical assistant, or office manager can order clinical supplies without having to learn a brand new system. If they know how to use Amazon, they can use the system, for example. And reducing strain on IT services. I think this is one of the other areas where cloud-based solutions reduce the stress on IT teams, because a lot of the infrastructure elements are taken away from the equation, but still is completely controllable through security. So IT retains the security posture they need to keep, and it has control over the data, but you don't have to worry about other things in a cloud environment. And also newer systems also allow you to multi-touch, in the sense the kind of device is irrelevant, because somebody in the clinic could order their supplies using their iPhone, for example, if you allow them to. So the product itself is accessible through mobile devices, iPad, tablets, desktop, other things as well. So same thing with the data. You have data available. If you make the data available to an office manager, for example, the data is, they can work with the data using Excel type of interface or other reporting interfaces as well. And the last thing is about Microsoft Cloud for healthcare. What Microsoft has spent a lot of energy in making a healthcare environment in cloud secure, scalable, and agile. So it gives you a framework where you can continue to build solutions beyond what comes out of the box. You can custom build solutions on top without impacting the base services. So it gives you a lot of flexibility. Next slide, please. So the advantages of newer healthcare supply chain system is that higher level of patient care and satisfaction. So the idea of supply chain assisting in the delivery of care by providing the right supplies at the right time, and reducing the manual labor, like I said, having to fax a paper down to central supplies or other things. A browser-based solution which makes a process much easier, and increased revenues, better charge capture. There are billable supplies which can be accounted for real time rather than waiting for reconciliation at the end. And the risk of waste and expiration dates. So the newer system has the ability to handle expirations and batch numbers and recalls and other things, so that the chances of something showing up in OR that needs to be tossed, that goes away. And safety, patient safety, but in terms of providing the right supply at the right time and avoiding supplies which should not be used, and regulatory compliance. For example, the systems allow you to track, if it is a pharmaceutical supply, do track and trace using regulatory compliance in terms of batch tracking, etc. You could control whether the particular supply can be delivered to the floor if the expiration date is within certain dates, for example. Scalability, we talked about the infrastructure. The product itself is scalable. You acquired another hospital. You don't have to wait for IT to go buy new hardware. Microsoft automatically scales things up. And administrative time, again, security and other things are tied to your directory, Active Directory, that saves as well. Cloud environment I talked about. Cloud environment allows people to scale the environment without significant time spent by the IT staff. And reporting. This is one of the biggest things because we are talking about reporting as not as a separate event. Like when you log in as a manager, you can see the current state of things at a real-time basis in a dashboard. You can say if we are running short on certain supplies, you can show it in the dashboard as you log in. You don't have to go and run a report to get that. And again, we talked about supplier relationships, same with the clinician relationship. So you can use the supply chain product to continue improving the relationship using integration. Maximizing inventory investment. As you know, better managed inventory means better maximizing your inventory investment and minimizing wastage. And pandemic mitigation is another key element. I think in the inventory visibility and forecasting, the AI models we have built has come a long way. They can predict based on previous happenings as well as anticipated events. And there are a lot of tool sets available right now. Thank you. Next page, please. Pat, I will turn this over back to you.
Okay, thank you, Suresh. So one of the things we saw when we did the poll was this idea of disconnected systems. One scenario is a lot of people have put in disconnected e-procurement systems to make it easier on their end users to be able to have an Amazon-style procurement. So, but then it's disconnected from what's actually in inventory, which can cause additional buying, and that's not necessarily leverage preferred vendors and discounts. There ends up being more expired materials because these systems are disconnected, and generally it's just not an effective process. What we've seen is we're in the current process of implementing an e-procurement kind of system, but it's integrated into the whole supply chain ecosystem. And in fact, this particular customer has decided to, they had 10 punch-out vendors, which made it virtually really difficult for their end users to do ordering because they didn't know which punch-out vendor had which supplies. And so they've decided to put all of the supplies, while it's a big initial task, they're going to put all of their supplies as if they're inventory supplies and eliminate that discrepancy for their end user. So they'll find that they'll have, and they're also implementing robust PAR management at all of their sites. So all the end users can have to do for the PAR management specific thing is say, okay, we have 6 on hand, and then the system will automatically order whatever's needed. Another way is to make sure that, as Suresh talked about, providing data insights can mitigate many of these issues. By using dashboards, you can easily see issues and improve processes, and therefore make sure you have the supplies that are needed to provide effective patient care. Next slide, please. As we all know, physician preference items are a big issue. Oftentimes they're more expensive than comparable alternatives. And as I said earlier, they can account for anywhere between 40 to 60% of a hospital's total supply costs. These often contribute to excess supply chain spending. Also, sometimes they're not the most clinically effective as other more cost-effective alternatives may be. So how do you move forward with improving and moving physician preferences to more preferable advice? I'm just going to talk about one study that was done. All this, they informed, they formed two groups. Physicians that were participating in the study were going to receive a financial incentive if they could reduce supply chain costs by 5%. The test group was provided with scorecards detailing monthly cost, high-priced items, and ranking by other surgeons for the same procedures, while the control group received no cost-related information. After a year, the test group was able to successfully reduce median supply chain costs by 6.5%, while the control group, which did not receive just some basic information, the cost there rose by 7.5%. So essentially a 14% difference just by providing information to the group about what their costs were, how it was used, and the ranking of that particular item. So I'm going to turn it now back over to Suresh.
I apologize. I'm back online.
Okay.
The data. We talk a lot about data. I think one of the biggest gaps I had in my previous attempts to supply chain automation is the data silos. I think one of the things the newer platform providing bring data together. Your utilization data from a patient care perspective, from a supply chain perspective, from a financial perspective. Pat mentioned physician preferences. One of the use cases we did, it's easy to show for the same procedure how surgeons' preferences impact cost in a real-time basis, doing analysis not at the month end. And this makes you talk to the surgeon with the knowledge in your hand. You can show them the data. And it also provides competitive advantage, I think, in terms of working with suppliers, where you can go back to them and show competing supplies and show the differences in a real-time basis. Improving patient care, like I said, real-time information about the products makes it better. For example, one of the use cases we worked with a customer where we were able to do some AI analytics with the joint replacement programs where we could reduce the number of implants you send to the OR. That's by reducing contamination. Instead of sending +2 and -2 sizes of knees, you can make it to +1 and -1. That is 2 implants that do not get into the OR. So I hear some noise. Anyway, and it allows you to create more personalized treatment as well and more informed decision making. And of course, reduces cost. I think we have worked with another use case where RFID tagging was used to identify like items that need to be sterilized versus disposed, so that the difference between different procedures can be easily calculated in a real-time basis. So the data collected during every phase of a supply chain is usable in making real-time decisions. So the newer platform will allow you to do that real time. Next, please. So the part of getting all your data, whether the data from EMR, of your financial systems, and your supply chain systems, and getting into a single platform gives you a lot of the ability to do AI-specific insights. And these insights, you can predict inventory visibility based on time elements versus procedure volume and other things. And it can create intelligent work lists, and which basically improves your workers' productivity as well as improving your workflows. For example, your buyer, for example, who needs to work on a work list every day, that work list is so intelligent it can prioritize their work for the day. You don't have to do manual work to say, today you're going to work on the CIP related purchases and you do something else tomorrow. So you can automate a lot of those tasks. And this newer system allows you also to enable process improvement through continuous feedback of data. And the HIPAA compliance, in terms of as you integrate data from EMR and patient-specific data, keeping it secure is very important. And these cloud-based solutions provide HIPAA compliance through high trust certification, other means. And from an IT perspective, you have complete control over access, and you can control users' access to granular level in terms of which data element and which user, And we always had in healthcare gap between patient-centric systems like EMR and supply chain-centric system. So supply chain works very hard to make patient care work well, but the data collected through patient care does not really feed into supply chain to provide the insights you need. So the newer platforms allow you to do that. So that's where data integration and unification of data and interoperability are key elements to get those things done. So next one, please. I think that's it. So in terms of case study, Pat, I'll turn it back over to you.
Okay, thank you, Suresh. So I'm just going to talk briefly about a case study, and we've actually highlighted that in the resources section. You'll be able to get more detail on it. But one of our clients, a small hospital in the Southwest, saw a dramatic improvement from implementing a modern supply chain system. First, they saw improvements in the warehouse with automatic reordering levels, with knowledge of back orders, so they were able to mitigate any issues. They keep a 30-day stock of critical items, so they always know exactly what they have. One of the most dramatic impacts was they were able to save over 5,000 hours of clinical staff time, mostly by implementing PAR levels at many of their sites. So they're able to manage inventory by implementing min-max and then having automated reordering. They're moving towards having 95% of their items ordered using purchase orders instead of, ad hoc orders. And they've implemented three-way match. They've also eliminated most of the paper out of the supply chain. And as the director of supply chain there will tell you, they now have time to think and to plan for things like pandemics. Next slide, I'll turn it over to Suresh and he'll take us to the end here.
Yeah, thank you, Pat. So in terms of getting started on the supply chain improvement, I think Pat mentioned one KPI, for example, number of clinical hours saved. I want to make sure that we don't mislead you. 5,000 hours in a smaller health system, 5,000 clinical hours, they did add non-clinical hours to offset some of that. It's not pure savings in terms of we are able to eliminate 5,525 clinical hours. They did supplement non-clinical users into that operation, so that allowed clinical staff to focus on patient care rather than spending the time filling out forms and sending it, tubing it down versus faxing it down, etc. So I think there are many KPIs you can come up with. I think some of the sample KPIs we put in the under here is setting up goals in terms of supply expenses, a percentage of your collected revenue, total spent under management, inventory turns, supply FTEs for per million total non-labor supply expense. These are some of the KPIs we have seen with our customers. And expired products, especially in pharmaceutical and clinical areas, expired product is a major issue. And again, setting up thresholds in terms of moving inventory between, especially for a health system which is multi-state, your inventory location, primary supply location is in one state, and there are state-specific regulations on expiration date, so you can handle all of that in your modern system. And the substitution of products, that's another thing, one of the KPIs, whether every item in the item master has identified substitutes or not. Primary distributor are providing most of the inventory, and percentage of items in the item master. Pat mentioned one customer where punch out was a major issue. I think whenever people are given choice to go to a third-party website to order things, people did that more often. I think by forcing them to go to the catalog, internal catalog, and hiding the fact that some of these items are coming from a punch out, and that saves a lot of time in terms of UI, user interface, in terms of people's ability to navigate through screens, etc. too. Office supply, another area of concern, measuring that as well. And so there are a number of potential KPIs are limitless. I think we could work with you, and there are others. Some of these suggested KPIs came from AHRMM, and there are other sources as well. We can provide other resources as well. Next slide, please. So one of the steps we recommend to a lot of our customers is that Microsoft has a framework for assessment, and that assessment will do a business transformation strategy development, and they will do a envisioning session, planning session, and come up with a strategy which will allow you to enhance your healthcare supply chain using Microsoft Dynamics products, Microsoft Power Platform, and Microsoft Cloud Services. And I think if you want to know more about the Microsoft Catalyst program, and some of these programs are partially or fully funded by Microsoft as well, depending on the situation. And then Kuzitu can provide you more information on this Catalyst program as well. And with that, I will turn you over back to Monique.
Thank you so much, and sincere thanks to both Pat and Suresh for sharing so many valuable insights on this important issue. So let's transition now to the Q&A portion of today's event. Just a quick reminder that if you have a question, you can easily submit it at any time using the portal on the left side of your screen. So let's launch into the pre-submitted questions. Of course, any unanswered questions will be addressed post-event. So first and foremost, Pat, One question that came in, I'll direct your way. How can I better anticipate future shortages in materials, and what type of communication should I have with and from my vendors?
Well, I think having good vendor communication is key to the shortage issue. Having vendors that you can trust that will give you accurate information, and they know where their supplies are coming from, keeping abreast of current events. Obviously, if you were getting supplies directly, say, from the Ukraine or Russia right now, you'd have some issues. So you have to just keep an open dialogue with your vendors, have trusted vendors, but also have backup vendors. We saw that during the pandemic, some hospitals created relationship with other hospitals in a different part of the country, so that when the pandemic was greatest in New York, they were borrowing supplies from places like Texas and other areas where the pandemic wasn't as great. And then as it shifted across the country, they would reciprocate. So developing relationships with your vendors, working with your GPO if you do have one is key, and then working with other organizations, similar type organizations, I think are three key areas that you should have some planning efforts around.
Thanks, Pat. Suresh, I'll direct this next one to you. Question came in. I've heard just in time and just in case as terms in healthcare orgs. Are providers today leaning towards one inventory process over another? Are they mutually exclusive, or could you go with just in case at some points and then minimize inventory with just in time? What's your perspective on that, Suresh?
I think the pandemic made a huge had a huge impact on this decision, this methodologies, because healthcare over the last 20 years have been moving more and more towards just-in-time inventories like most other industries, because the healthcare has always been traditionally just in case. We had everything on hand. So the pandemic made us go back more and more towards just in case, and I think things are starting to stabilize again. Every health system is going to handle both type of models, just-in-time model versus just-in-case model, depending on the inventory item. Because as you know, pandemic made us stock up on things because we are not sure what was going on. I think I mentioned the data platform. As we analyze the data related to pandemic and post-pandemic, we will stabilize into a situation. I predict we will go back to just-in-time inventory model slowly again.
Great. Pat, here's a question for you. How's the relationship between physicians and procurement specialists changing from the pandemic? Is it changing at all?
Well, I think that during the pandemic, the procurement specialists sort of had the upper hand because, they needed to get whatever they needed to get as soon as possible. And so they were going to lots of different places to get that than they might have previously. On the other hand, we really saw the amount of elective surgery come to almost zero, and organizations are beginning to go back up to more normal levels there, which then gives the physician a more of an upper hand. But I think, as I said when we were talking about the physician preference, it's got to be a joint effort between supply chain and physicians, and you have to give the physicians the data they need to make good decisions. We saw from that case study that I talked about, when they're given information, they will make different decisions. And so it's got to be, it's like a hand-in-glove relationship. One has to work with the other, but it should be led by supply chain, but it needs to bring in the proper administrative staff as well as physicians. And that's another area Okay, I'll just leave it at that for now. Thanks.
No worries. Suresh, here's one your way that's not too different from what we were just talking about. There's so many aspects to supply chain management. Is there, in your opinion, a rule of thumb for prioritizing vendor relationships over physician preferences, over ease of procurement? And what criteria should I use in evaluating where to start to improve my supply chain processes?
Yeah, I think most cases, our health systems are in a GPO. The GPO is controlling a lot of this relationship. So I think what my experience has been working with the GPO to make sure product-specific suppliers. For example, when I worked with an IT having a GPO contract for certain items within IT did not make any sense to me. So we worked closely with the GPO to create a relationship and priority for IT-related purchases differently than the other purchases. So one of the areas to look at is look at closely at your GPO contract, and then look at next level, which is product specific, but as long as the platform is not customized to do that. So make sure those relationships are transparent to the end user, but still work behind the scene with the GPO. That would be where I would start.
That's great. Another question, Pat, for you. I know that Suresh had reviewed the KPIs for supply chain, but and I can pull those up for our viewers to see. What do you consider the top KPIs?
Well, I think that could vary by organization, but certainly you want to understand your spend and where your largest spend is going. We know that it's probably going into the surgical area, but which areas of surgery? If you have a large orthopedic practice, probably a lot is going into that area. If you don't, then you need to evaluate specifically where your spend is going and try to determine if there's opportunities to reduce that spend by either standardization or finding alternative products in those areas. So understanding your spend is key to beginning to reduce supply chain costs.
Great. So that concludes the time we have available for today's session. Shortly, all the attendees will receive an email with a link to the webinar session replay and the presentation along with any of those resources there. We welcome your sharing that with others in your organization. Note too that our presenters have graciously provided their contact information for any additional questions. Thank you so much for making the time to participate in today's webinar. A sincere thank you to our sponsor, Quisitive, and to our very informative speakers, Pat Becker and Suresh Krishnan. That concludes today's program. Have a wonderful afternoon, and please stay safe.
Thank you, ladies and gentlemen. This concludes today's presentation. You may now